Dr. Kim, could you please tell us a little bit about yourself?
Hello, my name is Dr. Kim. I'm from Keystone Industrial Medicine. I am board certified in occupational medicine as well as preventive medicine, and I have a master's degree in public health.
Please tell us about the coronavirus that we've been seeing all over the news. What exactly is it?
So, coronavirus, as the name suggests, it's a virus. This typical strain, the COVID-19, recently caught the attention of the media. Started in Wuhan, China, as many of you guys know. There are other sporadic concerning geological global locations such as Italy, Japan, South Korea, and Iran. And recently, there has been some cases in United States, which became a little bit more of a concern for us here.
Can you tell us a little bit about some of the symptoms that you may experience if you're exposed to the coronavirus?
Sure. So coronavirus symptoms are very similar to other flu-like symptoms, such as shortness of breath, fever, coughing. These are the symptoms that is known to be associated with coronavirus.
So speaking of the flu, I haven't gotten my flu shot yet this year. Do you recommend getting it now, and would that protect me from contracting the coronavirus?
I do. Flu vaccines are strongly encouraged from my perspective. It doesn't necessarily protect you from the coronavirus, but what it will do is to ensure that you wouldn't get the flu virus, which can be confusing. And one individual who has a similar symptoms at least would know that if there's a symptoms, it may not be from the flu. So it's a great thing.
So I'm still really worried about contracting the coronavirus. How does it spread?
So there's a two method of contracting coronavirus. One is the respiratory droplets. So if someone were to cough and there's a tiny particles that would then another person would inhale and you could get a coronavirus. Another way is by contact, through contacting your hands to your mouth, your eyes, your nose, and you can have a transmission in contact way as well.
Should I be worried for my kids or students contracting or being exposed to the coronavirus?
The kids in general, I would say, are minimal risk. They usually are local. They go to school, they go to home, as well as their immune system is actually well functioning. So I wouldn't worry too much from a student's or kid's perspective. The ones who should be more cautious are the ones who travel for work, as well as elders who may have a less of a strong immune system, or people who has organ transplants, or HIV who has immunocompromised or immunosuppressed stage.
I know you stated that I shouldn't really be worried, but I still can't help feeling uneasy. What are some of the best precautions I can take at work and at home?
It promotes good personal hygiene practice, and this is no different. Hand washing with soap, at least 20 seconds. Cleaning the hard surface that with the hand wipes that is frequently used. The mask, if to be on a smaller confined spaces with others, are a great way to protecting yourself from a coronavirus.
You stated that the risk of contracting the coronavirus is very low, but why is the term global pandemic being used all over the news?
Well, when there's a new strain that is concerning and it's affecting many people, and when the virus is not localized to one place, say Wuhan, China, but also because of global transportation has improved, and you're seeing coronavirus popping up in other countries. That's what's making it considered global pandemic.
What can my school or school district do to prevent the spread of the coronavirus into and throughout our communities?
That's a great question. One, if you are sick and you have a fever and you're concerned, you should stay home. The recommendation is to stay home for 14 days and check your temperature on a daily basis to make sure there is no fever. Viruses treatment is self-limiting, meaning with rest, you should feel better. However, if you have shortness of breath or other concerns, you should call your doctors and perhaps have a further discussion about it.
Is there any medication, any vaccination, or preventative measures for the coronavirus at this time?
Sadly, there is no vaccination, but from what I gather, they're working on the vaccine. And as I mentioned, the virus is self-limiting, meaning with rest and time, it should resolve on its own. It's only a concern when the symptoms are magnified and you're having other serious symptoms like respiratory shortness of breath. Otherwise, you should feel better with time.
Okay. At this time, I would like to thank Dr. Kim for joining us today, and for the sake of our members that are watching this video, we'd like to summarize a few of the key points that we spoke about. The current recommended precautions to avoid exposure to the virus are the same precautions you should take to avoid the flu. Wash your hands often with soap and water for at least 20 seconds. If you sing the happy birthday song twice for washing your hands, it's an easy way to keep track of the time. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands, and avoid close contact with people who are sick. Cover your coughs or sneezes with a tissue and throw the tissue in the trash. If tissues are not available, cough or sneeze into the inside of your elbow, then wash your hands. Clean and disinfect frequently touched objects and surfaces. As with any illness, please stay home when you are sick and do not return to school until your temperature is under 100 degrees without the use of fever-reducing medication for at least 24 hours. We are monitoring the communications with experts from the CDC, County Health Department, and the Governor's Office, the State Superintendent of Public Instruction's Office, and the California Department of Education. The health experts at the county and the CDC will provide us with information as they have it, as well as specific instructions on school operations in the event of any occurrence of the virus within our school communities. We recommend that you work with your labor partners to carefully review the impact of the virus and what it could have at your school sites and work sites more broadly, and its potential impact on district operations. As mandated by law, sanitizers and disinfectants can only be applied by properly trained personnel such as custodial staff. Although custodial staff is ultimately responsible for cleaning, it's recognized that teachers and other staff conduct additional cleaning. The Healthy Schools Act requires anyone using any pesticide at a school or child care center to complete the Healthy Schools Act training. People who may need the training include custodians, nutrition service workers, groundkeepers, teachers, child care staff, and pest management professionals. If you would like further information regarding the Healthy Schools Act and the training required by DPR, please contact your California Schools JPA Benefits Account Manager or your assigned risk manager.